Fever. Simple Ayurveda remedies. The human body has a normal temperature of 37 degrees Celsius or 98.6 degrees Fahrenheit. Any variation in this core figure implies that something is amiss. Fever is a protective mechanism of the body. The body's response to tissue injury. Causes and symptoms. Fever may be caused by infections, mechanical trauma, anemia, heart attack, stroke, hemorrhage, certain metabolic disorders, arthritic conditions, drug reaction, immune dysfunction or cancer. In fact, anything wrong with the body will trigger this reaction, initiated in a center located in the hypothalamic region of the brain, called the thermoregulatory center. Essentially, fever is actually the beginning of the healing process, rather than a symptom. It helps mobilize the white blood cells of the blood, to destroy the invader, and either engulf and ingest it or carry away the debris for removal by the kidney. White blood cells or WBCs also form a protective screen by the release of antibodies to counter a subsequent attack. Usually fever, or pyrexia as it is known in medical terms, is a manifestation of a disordered state in the body, yet there are some normal physiological periods in the body's rhythm when a variation in core body temperature may occur. These are periods following vigorous exercise, the latter half of the menstrual cycle and pregnancy. Normal temperature also varies at different times of the day. It is slightly higher during times of physical activity and the lowest during sleep. Just before the menstrual flow begins, the temperature falls a little and still further, by as much as a degree, 24 to 36 hours before ovulation occurs, that is between two menstrual flow cycles. After ovulation has occurred, it goes up a little and maintains the same level till the beginning of the next flow. The normal body temperature may also rise a little on an exceptionally hot day. Extreme rise in temperature indicates bodily dysfunction or disorder. Most viral fevers are self-limiting and rarely last more than 3 to 4 days. For example, influenza and common cold. Fevers lasting more than a week are caused by less common infections and are likely to be bacterial in nature. For example, a fever which rises and falls daily but never reaches baseline, is likely to be typhoid or paratyphoid. A fever persistently hovering above normal but never really high enough to need a doctor, may be of tubercular origin, or due to an undiagnosed neoplastic growth. Very high swings in temperature, accompanied by chills and rigors, with a fever abruptly falling, with sweating, may point towards malaria. Febrile states alternating with afebrile or no fever states, the intervals being 1 to 2 days, may also be due to lesser known infections. Most fevers caused by seasonal, mild viral infections can be safely handled at home. However, there are some mild, undiagnosed, low-grade fevers which occur in young women, which do respond to home remedies, but recur again and again. These do not have a disturbing general state accompanying them. Watch out for them, as they may well be the sporadic subclinical signs of underlying urinary tract infection. High fevers cause dehydration. Excessive sweating causes loss of salt, water and vital electrolytes. Fevers higher than 40 degrees centigrade may cause mental confusion, twitching, tremors, delirium and convulsions. Remedies. Bed rest. Rest of fever is an oft-forgotten piece of advice from grandmother. In a fever, the body's defense mechanisms come into play and need a helping hand. Fever should be suppressed only if it goes above 39 degrees Celsius or 101 degrees Fahrenheit. If the fever is high, apply cold compresses on the forehead and sponge the whole body with tepid water. You can add a few drops of eau de cologne, lavender leaves, or a gentle soothing perfume to the water used. This takes away the sour smell of fever. Do not bring down the temperature rapidly, as this confuses the body's temperature regulating center, causing the body to go into shock. This can be dangerous. Give plenty of fluids orally. Fever causes dehydration. Go slow on food. A day of fasting helps. In most fevers there is an initial loss of appetite, as the body is using all its energy to combat the cause of the fever. As soon as the temperature comes down, appetite returns. This, in turn, depletes the body's glucose energy sources. Hence, fruit juices and vegetable soups are ideal nourishing diets for a person with fever. The food should be easily digestible, light soft food. Kanji, a very thin rice gruel seasoned with a flavoring of garlic, with salt to taste, is a favorite in South India. It replenishes lost strength and brings back appetite in febrile conditions. The leaves of the holy basil plant lead the home herbalist as a febrifuge. The leaves of this plant not only bring down temperature but relieve pain, clear respiratory passages of congestion and flush out the kidneys. Its anti-inflammatory and its analgesic properties are well researched and documented. Holy basil leaves are excellent as a preventive and curative remedy for seasonal fevers. To 1½ teaspoons of dried holy basil leaf powder, add an equal amount of dried ginger powder. Brew with a glass of water to make a soothing tea. Add sugar and milk to taste. Have 3 to 4 times a day. Fresh ginger and holy basil leaves can also be used, but they need to be boiled a little longer to make a decoction. These are especially good for influenza, common cold and all respiratory tract infections. If there is an accompanying cough, add a few ground peppercorns. If the cause is self-limiting, 2-3 days administration will cure the condition. However, chronic conditions will need simultaneous investigation and supervised, specific medical treatment. A standard mixture, very effective by itself, or as a complementary remedy for bronchitis, tuberculosis, cancer of the lungs and gastrointestinal problems, is made by boiling 2 cups of dried Indian gooseberry with 4 cups of water, till just a cup remains. Strain this and keep aside. Add a level teaspoon each of dried powdered ginger, coriander seeds, cumin seeds, black pepper, long pepper, cloves, cardamoms and cinnamon. Boil this mixture again for a couple of minutes, stirring continuously. Make a syrup, using a cup of sugar for a cup of water, till it is of a one-thread consistency. Add this to the condiment, spice mixture. Boil it again. Now add a cupful of melted ghee, made from cow's milk butter. Stir well till the mixture is well blended. Cool and store in a clean, dry glass container in a cool, dry place. A level teaspoon of this mixture, taken twice a day, is a keen appetite stimulant, a good digestive, and rich in vitamin C, plus the principles released clear the respiratory passages of phlegm and blockages. For suspected malarial fever, a decoction can be made with 2 tablespoons of the pounded bark of the neem tree, 2 tablespoons of pounded coriander seeds and a teaspoon of cardamom. Add to this 2 glasses of water. Bring it to boil and simmer for half an hour. Adult dose, 4 teaspoons full thrice a day. To mask the bitterness of neem, add honey or sugar to taste. Another variation of this basic neem fever potion is 2 teaspoons each of pounded neem bark, pounded cloves and pounded cinnamon. Mix well, add 2 glasses of water, and boil for 15 minutes. Strain through a clean muslin cloth and dispense an adult dose of 4 teaspoons full thrice a day. A herbal tea prepared by boiling 8 to 10 leaves of holy basil with 3 to 4 fresh, new leaves of the jambule tree, neredu, in a cup of water, cooled and sweetened with honey. This is a soothing, refreshing drink, and lowers the temperature in malarial and heat stroke fevers. Fevers caused by gastrointestinal problems and respiratory infections respond well to a teaspoon of turmeric powder added to a glass of hot milk with sugar to taste. If there is also constipation, add a teaspoon of hot ghee, clarified butter, stir it well, and while it is still quite hot, drink it in one go. Turmeric has a tendency to settle down in the tumbler, so if you want to sip this drink, keep stirring it. Patients with diarrhea, dysentery and fever, especially in summer, should be given bilva fruit sherbet, alternating it with the holy basil fever potion. This is prepared by mixing the pulp of 3 ripe bilva fruits in 2 glasses of water. Add sugar to taste. Adult dose, 4 tablespoons full 3 to 4 times a day. Give the patient plenty of water to drink, spaced out in between these periods. Fenugreek tea, half a teaspoon of fenugreek seeds, boiled with a cupful of water, cooled and flavored with a teaspoon of lemon juice with honey, sugar to taste, removes the foul sour taste in the mouth and the unpleasant body odor associated with some fevers. Take a handful of crushed fresh mint leaves, 2 to 3 black peppercorns, 2 to 3 long peppers, a 1/4 inch piece of ginger, ground to a fine paste. Boil it in 2 cups of water, simmer it for 12 to 15 minutes. The cooled, filtered mixture, divided into 3 doses and sipped as a herbal tea, gives relief in fevers associated with gastrointestinal disorders. Make a decoction with 2 tablespoons of fennel boiled with a cup and a half of water, reduced to 3/4 of a cup. A tablespoon of this taken twice a day helps in respiratory and gastrointestinal fevers. Suspected typhoid fever can be treated with a decoction made by boiling 10 grams of Sesambrium with 10 grams raisins in a liter of water. Boil till it is reduced 1/3 of the original quantity. This can be given with other medicines. Malarial fevers respond well to a herbal tea made with Karata tikta, also known as Nelivema leaves or stems, whether fresh or dried, with honey added to mask the bitter taste. These are usually available in their dry form at the grocery shop. This remedy does not have the side effects of quinine. The stomach tolerates it well. However, an overdose causes sickness and a feeling of heaviness in the stomach. These plants grow wild in gardens in the northern and northeastern regions of India. A teaspoon of dried leaves or plant powder, made into a decoction, can be taken thrice a day. If it is growing in your garden, use a tablespoon of crushed leaves. A lesser known remedy is the leaves of the coral jasmine or night jasmine. Its flowers are white, with a saffron-colored corolla. It has a pleasant fragrance and is usually offered in Hindu temples to the deities. The leaf has antipyretic properties. The best herbal treatment for malaria is a tea made with 12 grams of dried holy basil leaves and 3 grams of black pepper powder, taken thrice a day. Honey, palm candy or sugar are optional. For a fever caused by a hot day out in the sun or during delirium associated with certain fevers of the nervous system, an infusion of fresh sage leaves is very soothing. At the same time, sage tea is highly beneficial in typhoid fever, fever with cold in the head, a sore throat, a peritonsillar abscess also known as quinsy, measles, joint pains, and biliousness associated with liver complaints. To make sage tea, put 25 grams sage leaves in a pan and pour a liter of boiling water over it. Cover and keep aside to cook. When cool, add 3 tablespoons of fresh lime juice and 2 tablespoons of honey. Stir and serve cold 3 to 4 times a day. Take 1 tablespoon of fresh, thick tamarind extract. Add a glass of boiling water to it. Cool, strain and add sugar to taste. You can have it fairly chilled if you like. It brings down fever speedily in summer. Lemongrass tea, with honey to taste, is a refreshing remedy. The application of cool sandalwood paste on the forehead brings the temperature down, just like a cold compress. This is all about fever. If you need further help, feel free to contact this author. Take care about your health. After all, health is the most important thing in your entire life. If health is lost, something is lost. Arogyamastu.
Dr. Chirumamilla Murali Manohar, MD, Ayurvedam, Raksha Ayurvedic Center, Sardi Studios Road, opposite State Home, Amirpet, Hyderabad 73. Phone 9177445454.